It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following: causes of intestinal obstruction in dogs. Anything that blocks the passage of food through this tract, partially or completely, constitutes an intestinal obstruction. It may be a foreign body that a dog has eaten but cannot fully digest, changes in the conformation of intestinal segments, such as in cases of constriction, or the presence of intestinal growths or tumors. The intestinal tract is the main set of organs responsible for digestion and absorption of nutrients. For a dog to absorb nutrients from the food it eats, they must travel through the entire gastrointestinal tract, from the stomach to the final part of the intestines. Ingested food undergoes digestion and absorption processes as it descends through the intestinal tract. Intestinal obstruction in dogs is a serious medical condition that can be fatal if not detected early or treated properly. 1. Signs of intestinal obstruction in dogs. Intestinal obstruction in dogs has widespread symptoms in the initial stages of the condition. This makes detection and diagnosis a little difficult. Initial signs include loss of appetite, generalized weakness, abdominal pain, and vomiting. If undetected for a prolonged period, the signs progress to severe weakness and lethargy, excessive vomiting, often with foul-smelling vomiting, dehydration, and eventually shock due to fluid and electrolyte imbalance. It is important to detect early signs of a possible intestinal obstruction so that supportive treatment can be given immediately to prevent the condition from worsening or even becoming fatal. 2. Common causes of intestinal obstruction in dogs. The most common cause of intestinal obstruction in dogs is the ingestion of foreign bodies or non-food materials. A dog's behavior of chewing and swallowing various things puts him at high risk of developing a foreign body obstruction. Certain food ingredients can also cause intestinal obstruction in dogs. Fruits such as mangoes and avocados have large, hard bones that, when swallowed, can become lodged and stuck in the intestine and cause blockage. Corn cobs are also a common cause of blockage in larger dogs. Eating poorly digestible things like grass or plants can cause obstruction if it builds up along the gastrointestinal tract. Linear foreign bodies, such as dog leashes or ropes, can also cause intestinal obstruction if ingested. Other possible causes of intestinal obstruction in dogs are motility problems that cause various changes in the shape and position of the intestine within the dog's abdomen. Food descends from the stomach to the intestine through peristalsis, a segmental contraction of the intestinal wall. Changes in the rate of peristalsis in different segments of the intestine can cause one part to zoom toward the next segment, causing intussusception. This condition obstructs the flow of food through the intestine and subsequently causes intestinal obstruction in dogs. Herniation of a portion of the intestine can cause stricture and is also another possible cause of obstruction in dogs. Most hernias in dogs are congenital but, in some cases, they occur as a postoperative complication in abdominal surgeries. Growths along the intestinal wall, such as intestinal polyps and tumors, can also cause obstruction if they grow large enough to block the entire intestinal lumen. 3. What are the treatment options for dogs with intestinal obstructions? Once confirmed, intestinal obstruction is treated accordingly depending on the cause. Surgical intervention is often needed to remove a foreign body causing the blockage or correct the condition causing it. Aggressive supportive therapy is needed before, during, and after surgical procedures to reduce the risks of complications and address secondary dehydration and electrolyte imbalances that may accompany the condition. Early detection and appropriate surgical intervention often result in good recovery after surgery. In severe and chronic cases, a segment of the intestine may become non-viable and must be removed, increasing the risks of postoperative complications. Intestinal growths, if solitary, can also be removed surgically. For cases of multiple intestinal tumors, proper identification of the tumor by endoscopic biopsy and subsequent medical treatment, such as chemotherapy, are needed. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.